Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Maria Petty. She's a nurse practitioner, and her Kevin MD article is titled Five Things That Are Helping Us Through a Miscarriage. Maria, welcome back to the show.
Thanks for having me, Kevin. Great to see you again.
Now, for those who didn't listen to our first episode together, and we're talking about a year ago, just briefly share your story and journey.
Sure. I've been a nurse practitioner since 2012, and I grew up with my mom and dad, and then with my mom and grandparents, with my dad still very much involved in my life. And I think seeing my grandparents manage their chronic diseases, my grandmother was on dialysis, and my grandfather had type 2 diabetes. I think that influenced my decision to become a primary care nurse practitioner. And I've worked in hospice, palliative care, skilled nursing facilities, and most recently in primary care at the VA since 2017.
All right. So just tell us that perspective now that you're a primary care clinician, but you've also had experiences in a lot of other areas that actually most physicians don't, right? Most physicians just go straight from residency into an outpatient setting, but you had the benefit of going to a variety of settings. So tell us how that influenced your perspective now that you're in primary care.
Thanks so much. I think seeing older adults and unfortunately some younger adults in the hospice and palliative care setting, and then in the skilled nursing setting, and seeing, the management of more acute issues such as pneumonia in those settings, and then getting to see outpatient kind of a lot of times a healthier group of patients, but
Hmm.
some unfortunately, I think having a perspective of different needs across the spectrum of illness, and especially now being able to be at the VA and access a lot of the resources available, especially through home care and social work available through the VA, has been a great benefit to me and great learning to me to be able to see patients going through multiple conditions in multiple settings.
All right. So let's talk about your Kevin MD article. It's titled Five Things That Are Helping Us Through a Miscarriage. Now, how did your article come together?
Thank you. So, unfortunately, my husband and I had a miscarriage in March of 2023, about 6 months ago. And we're very blessed to have each other. And we have two healthy boys who are 2.5 and 4 years old. And, I'm blessed to have medical knowledge. I have a friend who's an OBGYN. But, it was still hard for us, even though we had a lot of blessings and support and really tremendous care from our team. So, after, the initial grieving period, I really wanted to process and write my thoughts and also share what helped us and in the hopes of helping others. And I do want to thank you, Kevin, because I think having a formal way to share such thoughts is really beneficial and really motivating for me to be able to have like a reason to really write these things down.
So tell us about some of the things that did help you through this very difficult time.
Thank you. So, my OB clinic has what's called an early pregnancy assessment clinic
Mhm.
embedded with the regular OB clinic, and they actually call it PEACE, Pregnancy Early Assessment Clinic. I'm a Cleveland Clinic patient, so it's basically OBGYNs and nurses who are used to seeing patients who've had a miscarriage. So, basically when I went into the office and it was confirmed that I was having a miscarriage, I was immediately referred to a nurse who was great, really went through a bunch of signs and symptoms and things to watch out for, gave us her number to call if any questions, and I was immediately, you know given an appointment with an OBGYN who saw me the next day, prescribed medical curettage to help everything else pass. And they were all extremely competent, but also extremely compassionate, and just really were there for us, listened to us, really validated the loss. I had unfortunately have had some friends tell me that, they were kind of dismissed,
Mm.
just, well, okay, I'm sorry you've had this miscarriage, but if you're not having severe bleeding and you don't have a fever or anything, you'll kind of recover on your own, and good luck, and call us if you need us. But they were very proactive in the Peace Clinic. They reached out to me at least 2 or 3 times by phone just to check in. And I had at least two video visits and an in person ultrasound a few weeks later just to make sure. the other products of conception had passed and make sure I wasn't having any infection or any complications after.
Did you know what to expect after the miscarriage? And just talk about how this clinic kind of guided you through that process.
Sure. I didn't really know. Well, I guess I knew a little bit what to expect. I was having some bleeding, so heavier than what could be expected. So I figured that this was probably what was going on. And then, of course, looking up things on my own. But I didn't really know, there's different options. Sometimes people just wait and see versus there are medications that can help with basically having your body get rid of or expel the rest of the miscarriage. Some people, if it's later, I was at 10 and a half weeks, but people that are later in their pregnancy sometimes have to have the dilation and curettage in the operating room. So having somebody really talk about all those options and I opted with misoprostol, the pill to help. My body was able to pass everything mostly on my own, but having the pill to kind of help everything else come out was helpful, I think. And, not to be gross, I know you're a physician and heard many things, but it's a lot more blood and tissue than
Mm.
I expected. So having somebody be honest about that with me and honest about the severity of the cramping and let me know what options were available and when to seek emergent care. I mean, there was a lot of bleeding, but it didn't pass the threshold of like, if you soak more than 2 pads in an hour, I think that's more of the emergency room type of thing. But just having somebody really go through all that was helpful.
One of the things that you mentioned in your article was mindful self compassion that helped with the healing process. So tell us exactly what that is.
Oh, sure. Thank you. Yes, yes. Other things help me too. So I speak with a psychologist every few months, and she's been very helpful as well. And she recommended a book called Mindful Self Compassion by Dr. Kristen Neff. And it was very helpful. I haven't finished it yet, but just even reading part of it, she spoke about how it's very common, I think, for us to try to like, just get through, just push through. And I was really trying to do that. Okay, I'm so blessed. I have my kids. I'm gonna be all right. I have my husband, my family, but I think acknowledging like, this does hurt. This is a
Mm.
loss. And even kind of like using physical tools to soothe yourself, like actually putting your own hands on your heart and saying like, I am loved, or some people use first person, like I am loved, or some people you actually, speak more to themselves, like, may you be at peace, may you be well. It felt a little strange at first, admittedly, but I think, practicing some of that really did kind of help. Just breathing and putting hands on your heart, just trying to ground yourself, especially in those moments when you're feeling worse.
What other techniques did you use to help you heal during this period? I think another thing that you mentioned was journaling. How did that help you?
Sure. So, journaling both just informally and then writing this piece for your website, I think just helped me kind of make sense of everything, kind of have a narrative of what happened. I think just helped me to process it. And also, I know a lot of people don't talk about their miscarriages. They prefer to keep it a private thing, and I could certainly understand that. But I did actually I told my parents, I told some
Hmm.
friends at our church, and it's having people tell me, I'm praying for you and I'm sorry for what you went through. And so many people came out and told me that they had a miscarriage and what they went through. And it actually, it really, I thought it helped me. I mean, I think I'm the type of person that the community and the prayer and all of that was very helpful to me.
For other families that may be going through a similar situation, what are some pieces of advice that you could share with them?
Sure. I would, advise them to reach out if they're comfortable to other people that have experienced this, to their OB office to see
Mhm.
if there is an early pregnancy assessment clinic within their OB office or somewhere else that they could be referred to. Um, I listed some resources in my article too, some hyperlinks of places where if somebody doesn't want to talk about it, but they want to read more, there's various websites, both from various religious perspectives and also from non religious perspectives. Children's Hospital of Philadelphia, where I had one of my clinicals, I went to University of Pennsylvania.
Hmm.
They had a comprehensive list of resources for people who not only had pregnancy losses, but also loss of a child as well.
We're talking to Maria Petty. She's a nurse practitioner. Her Kevin MD article is titled Five Things That Are Helping Us Through a Miscarriage. Maria, just share some take home messages with the Kevin MD audience.
Sure. If anybody's listening that's gone through this, please know sending my hugs and prayers. And if you've never heard of an early pregnancy assessment clinic or a fertility awareness, I would certainly encourage you to check out the hyperlinks in my article, and just encouraging the other clinicians out there, to all the OBGYNs who see patients who've had miscarriages or other losses, and all of us see patients with losses. Thank you for what you do, and having those moments of eye contact and compassion, even if it's brief, were so meaningful to me in a tough time. And I hope we can all encourage each other to give that to our patients.
Maria, thank you so much for sharing your story, time, and insight. And thanks again for coming back on the show.
Thank you so much, Kevin.